Welcome back to our channel, everyone. It's good to have you with us.
It certainly is. You know, Daniel, sometimes a thought crosses my mind, and I'm sure it does for many of our viewers too. What would happen if a serious health issue, like a heart attack, struck while you were home alone with no one immediately there to help?
That's a very relatable concern, Serena. It is a scary thought, isn't it? But today, we're going to face that worry with something very powerful: preparation. Because in a critical situation like that, recognizing the signs early and knowing exactly what to do can truly be the fine line between life and death.
And that preparation can make all the difference in feeling a bit more in control, even when thinking about something so serious.
Precisely. In this video, we're going to dive deep into the topic: heart attack alone. These 7 steps could save your life at 60. Step 4 is often missed. And before we get into each specific action step, the absolute first and most crucial thing we all need to understand is step 1. Recognize the symptoms. And it's vital to never ignore them.
That makes sense. If you don't recognize there's a problem, you can't take action. So, what are we looking for? I think many people imagine that very dramatic, clutching the chest pain we often see in movies.
That's a common image, and it's true. Chest pain or discomfort is a key symptom. This could feel like heavy pressure, a squeezing sensation, or an uncomfortable fullness right in the center of your chest. It might last for more than a few minutes, or it could be intermittent. Perhaps it goes away and then comes back.
And does this pain always stay in the chest?
Not always. That's an important point. The pain might not just stay in your chest, it can radiate, meaning it can spread to one or both arms, often the left arm is mentioned, or it can spread to your neck, your jaw, your shoulder, or even into your back, sometimes between the shoulder blades.
That's a lot of potential variations. It sounds like it's not always a straightforward chest pain then?
Exactly. And this is incredibly important for everyone to understand. Not all heart attacks present the same way. The symptoms can be very different, especially in women, in older adults, or in individuals living with diabetes. You might not feel that clear, sharp chest pain at all. Instead, it could be a more vague, uneasy discomfort.
So, what other kinds of feelings or symptoms should we be alert to, especially if it's not that classic chest pain?
Well, you might find yourself suddenly short of breath, perhaps gasping for air even when you haven't exerted yourself. Some people feel nauseous, even to the point of vomiting, or they might experience a sensation like severe heartburn or indigestion that isn't actually related to a meal they've eaten.
Those are symptoms that could easily be mistaken for something else, I imagine.
They certainly can be. Other potential warning signs include breaking out in a cold sweat for no apparent reason, feeling dizzy or lightheaded, or experiencing an unusual profound fatigue or exhaustion that comes on suddenly. These are all signals we must not take lightly.
It sounds like the key is really listening to your body and not dismissing unusual feelings.
You've hit the nail on the head. I want everyone listening to this very carefully. If you feel anything that seems not right, a strange sensation in your body that you haven't experienced before, especially if it comes on suddenly and makes you pause and wonder, never just brush it off as simply being due to old age, general tiredness, or something you ate. Our bodies are very intelligent. They often send out warning signals when something isn't right. Our job is to learn to listen to those signals and act decisively.
So, no second guessing. If you feel something is seriously off?
Absolutely. If there's any doubt, even the slightest suspicion, that you might be having a heart attack, it's crucial to treat it as a medical emergency. Don't try to wait and see or diagnose yourself. Because in cardiac emergencies, healthcare professionals often say time is muscle. Every minute that passes without medical intervention, more of your heart muscle is being seriously damaged.
Time is muscle. That's a very powerful reminder of the urgency.
It is. So, the very first and most fundamental of our 7 life-saving steps is to commit these symptoms to memory, both the typical ones and the less common ones, and always trust your gut feeling.
That's a very clear and important foundation, Daniel. Knowing what to look for is definitely step 1.
Now, once you've recognized or suspect you're having those signs, we'll move into the next action steps. In today's video, now that we've clearly understood how to recognize the symptoms, we're going to walk through the remaining 6 specific action steps from step 2 to step 7 that you can take if you unfortunately find yourself facing a heart attack when you're all alone. And we'll pay special attention to the 4th step out of these 7, a step that, as our video title hinted, many people often overlook in a moment of crisis, yet it could be a deciding factor.
And because this information is so vital, Daniel, I think this is a good moment to remind our viewers. If you haven't already, please consider subscribing to our channel and hitting that notification bell. That way, you won't miss out on life-saving content like this.
Thank you, Serena. That's an excellent point. And we'd love to hear from you all in the comments as we go. Have you ever thought about this particular 4th step before? Let us know. Equipping yourself with this knowledge isn't about causing fear. It's about empowering you with strength, confidence, and a sense of control. So, let's continue.
Okay, so after recognizing the symptoms, what's next?
Once you've recognized suspicious signs, the very next thing you need to do immediately, without any hesitation, is step 2. Call 911 or your local emergency number immediately.
No delay at all? Not even a quick call to a family member or a neighbor first?
This step cannot be delayed. The moment you suspect you're having a heart attack, pick up the phone and call for emergency help. In the United States, that's 911. If you're in another country, please make sure you know your local emergency medical number. And to answer your question directly, no, don't try to call a family member first. Don't call your family doctor at that moment. And absolutely do not try to drive yourself to the hospital, even if you think it's close by.
Why is driving yourself so risky in that situation? Some people might think it's quicker.
That's a common thought, but it's very dangerous. If you are having a heart attack, your condition can worsen very quickly. You could lose consciousness while driving, endangering not only yourself, but others on the road as well.
That makes perfect sense. So, the ambulance is the safest bet.
Absolutely. When you call for an ambulance, the paramedics are professionally trained and have the necessary equipment to start treating you right there, even on the way to the hospital. They can monitor your heart rhythm, provide oxygen, administer medications, and even perform CPR if needed. These are life-saving interventions that you can't do for yourself, and that even a well-meaning family member without medical training usually can't provide.
So, when making that call to 911, what's important to convey?
When you call, try to speak as clearly and calmly as you can. Tell them your name, your exact address, your phone number, and most importantly, state that you think you are having a heart attack and that you are alone. The more accurately and quickly you provide this information, the sooner they can get to you. And don't hang up until the dispatcher tells you to. They may give you important instructions while you wait for the ambulance to arrive. Remember, calling for emergency help is the most critical action you can take to increase your chances of survival and minimize damage to your heart.
That's very clear. Okay, so you've called 911. Is there anything else you can do while waiting? I've heard about aspirin.
Yes, after you've called for help, and if you have it readily available in your home, there's a medication that doctors often recommend in this situation. That brings us to step 3. Chew aspirin, but with some very important caveats. Only if it's recommended for you and you're not allergic.
Aspirin. How does that help in a heart attack situation?
Aspirin can help thin your blood and prevent a blood clot from forming or getting larger. Often, a blood clot is the main cause of the blocked coronary artery that leads to a heart attack. So, if you are not allergic to aspirin, have no history of serious bleeding problems, and your doctor has previously discussed this with you, or you know you have no contraindications, the general advice is to chew 1 regular-strength aspirin, usually 325 milligrams, or you could take 2 to 4 low-dose 81 milligram aspirins.
And you specifically said, chew it. Why is that?
That's right. Chewing the aspirin instead of swallowing it whole helps the medication get absorbed into your bloodstream faster through the lining of your mouth. This allows it to start working sooner than if it had to go through your digestive system first.
That's a good tip. But you mentioned caveats. What if someone isn't sure about taking aspirin?
This is very, very important. If you've never taken aspirin before, or you're unsure if you're allergic, or if your doctor has specifically told you not to take aspirin for some medical reason, for example, if you're already on other blood-thinning medications or have a history of stomach ulcers, then please skip this step. Safety always comes first. The emergency medical personnel can also give you aspirin when they arrive, if they deem it appropriate for your situation.
So, this is definitely something people should discuss with their doctor before an emergency to know if aspirin is right for them in such a scenario.
Precisely, Serena. That's a crucial point of proactive health management. And if you do decide to take aspirin during an emergency, try to do it after you've called 911, so you don't delay that most critical action. And always remember to tell the paramedics when they arrive that you've taken aspirin and how much. This helps them have a complete picture to continue your treatment effectively. Keeping aspirin in your medicine cabinet in an easily accessible place is a smart preventive measure, especially if you have known risk factors for heart disease. Again, assuming your doctor has approved it for you.
Understood. So, we've recognized symptoms called 911 and considered aspirin if appropriate. Now you mentioned a 4th step that's often missed. I'm very curious about this one.
Yes, we now come to a step I mentioned at the beginning of the video. It's a step that seems so simple, perhaps even less critical than the others on the surface, yet it's the one most often forgotten in the panic of the moment, especially when you're alone. This is step 4. Unlock your main door and get to a safe position. This truly is the life-saving step that's often missed.
Unlock the door. You know, in a moment of panic, I can absolutely see how that might be overlooked. You'd be so focused on the pain or the fear.
Exactly. Picture this. You've called 911, they're on their way, but your front door is locked tight. When the paramedics arrive, they will lose precious moments. Moments when your heart is being starved of oxygen, trying to get into your home. They might have to break down the door, which not only causes damage, but more importantly, delays them from reaching you. And when you're alone, there's no one else there to let them in.
That delay could be critical. So, what's the advice here?
So, after calling 911, and if possible, after chewing aspirin, try to make your way to your main door and unlock it. If your door has multiple locks, unlock all of them. If there's a chain lock, unfasten it.
And after unlocking the door, should you just wait there?
Once the door is unlocked, if you still have the strength, try to lie down or sit in a position near the door. where paramedics can easily see you when they enter. If possible, it's often recommended to lie on your back with your head and shoulders slightly elevated, especially if you find it hard to breathe lying flat. This position helps reduce the workload on your heart and can make breathing easier. And definitely avoid pacing around the house. This can make your heart work harder.
It's fascinating how such a practical, simple step can have such a huge impact. Why do you think it gets overlooked so often?
Well, in the midst of pain and panic, our thoughts naturally focus on how to stop the pain, how to breathe. The seemingly mundane act of unlocking a door might not even cross our minds. But for the emergency response team, gaining access to you quickly is paramount. By unlocking the door, you are saving them valuable time, and that directly helps you. Think of this as an incredibly important act of self-care in an emergency when you are by yourself.
It's a way of helping them help you.
Precisely. So, remember this. Perhaps even tell yourself over and over as a little mantra for such a situation. Recognize symptoms, call 911, chew aspirin if okay, unlock the door.
That's a very powerful and memorable instruction. So the door is unlocked and you're waiting. That must be a very anxious time.
It certainly can be. Feeling scared and panicky is completely natural while you're waiting for help to arrive. But trying to stay as calm as possible can genuinely make a difference. Therefore, our step 5 is try to stay calm and conserve energy. And a key part of this is to breathe deeply.
Staying calm when you think you're having a heart attack sounds incredibly difficult.
It is, no doubt. But panic can actually increase your heart rate and blood pressure, putting even more strain on your already struggling heart. So, try to take slow, deep breaths. Breathe in slowly through your nose, feeling the air fill your lungs, and then exhale slowly through your mouth. Focusing on your breathing can help calm your nervous system and lessen those overwhelming feelings of panic.
So, focusing on something physical like breathing can help distract from the panic.
It can. And also, tell yourself that you've done the right things. You've recognized the symptoms, you've called for help, and they are on their way to assist you. You're not alone in this anymore. Professional help is coming. Avoid unnecessary movement or trying to do anything strenuous. Sit still or lie in the most comfortable position, as we discussed for step 4, and focus on staying calm. If there's someone you can quickly call, after calling 911 of course, to talk to while you wait, and if that helps you stay calmer, then do so. But the top priority is still to conserve energy and keep your heart from overexerting.
Any other small tips for trying to maintain that calm?
You might try counting your breaths or thinking of a peaceful place, a happy memory. Anything that helps you feel a little more grounded during this difficult time is valuable. Remember, staying calm not only helps you feel better mentally, but also has real physical benefits for your heart in that moment.
Good advice. So, you're trying to stay calm, and you're on the line with 911 presumably.
Yes. And once you're connected with the 911 dispatcher, clear communication and following their instructions are crucial. This brings us to step 6. Communicate clearly with the dispatcher, and very importantly, follow their instructions.
What kind of things should you be telling them, or what might they ask?
As we mentioned earlier, don't hang up until the dispatcher tells you to. They are trained to help you over the phone while the ambulance is en route. Try to answer their questions as clearly and concisely as possible. They might ask you about the specific symptoms you're experiencing, when they started, if you have a history of heart disease or other medical conditions, if you're taking any medications, and if you have any drug allergies.
So, they might also give instructions?
Yes, They may also give you specific instructions, such as how you should sit or lie, or whether you should take aspirin if you haven't already, and it's appropriate. Listen carefully and follow their advice. They are a valuable resource during those waiting minutes. If your condition changes, for example, if the pain gets worse or you feel more breathless, let them know. Maintaining this line of communication allows them to update the incoming ambulance crew and better prepare them for your care.
It sounds like they're your first line of medical support in that moment.
They absolutely are. Remember, the person on the other end of the line is there to help you. Even if you feel scared or find it hard to speak, try your best to provide the information they need. Your cooperation can help them make the best decisions for your care.
That makes sense. Now, is there anything else that can be done, perhaps to help the paramedics once they arrive?
Yes, there is. And although it can be difficult to think about in a crisis, having some key information ready can be incredibly helpful when the paramedics arrive. And if you haven't prepared it in advance, knowing what information is needed is also very important. This is step 7. Have important information ready, or try to recall it.
What kind of information are we talking about here?
Ideally, each of us, especially those of us age 60 and over or with existing health conditions, should have a personal medical information list prepared and kept in an easily accessible place. For example, on the refrigerator where it's visible or in your wallet.
That's a very practical tip. What should be on that list?
This list should include your full name and date of birth, a list of all medications you are currently taking. This includes prescription drugs, over-the-counter medicines, vitamins, and herbal supplements along with their dosages. Also, a list of any medical conditions you have, such as diabetes, high blood pressure, or previous heart conditions. Any allergies you have, especially to medications. The name and phone number of your primary care physician and any specialists you see. And finally, contact information for 1 or 2 emergency contacts or next of kin.
That's quite comprehensive. What if you don't have a list ready when the emergency happens?
If you have this list ready, try to point it out to the paramedics when they arrive. If you don't have one, and if you are still conscious and able to communicate, try to remember and provide them with the most crucial information, especially about the medications you take and any allergies. This information helps the doctors and nurses at the hospital make quick and accurate treatment decisions, and it can help them avoid unwanted drug interactions or dangerous allergic reactions.
So even a little information is better than none.
Exactly. Even if you can't provide much information in the moment, don't worry. Their first priority is to stabilize your condition. But if it's possible, providing this information will be very helpful. And this also serves as a good reminder for all of us. Take a little time today to prepare such a medical information list. It's not just useful in case of a heart attack, but in any other medical emergency as well.
That's a really empowering action we can all take right now to be better prepared.
It truly is. So, there we have it. 7 incredibly important steps that could save your life if you ever face a heart attack while alone.
Perhaps a quick recap would be helpful, Daniel, just to reinforce them.
An excellent idea. Step 1. That's recognizing the symptoms. Never ignore the signals your body is sending. Step 2. Immediately call 911. Step 3. Chew aspirin if it's recommended for you and you have no contraindications, and always after checking with your doctor about its suitability for you in an emergency. Step 4. This is the often missed but crucial one. Unlock your main door and get yourself to a safe position. Step 5. Try to stay calm and conserve your energy. Step 6. Communicate clearly with the 911 dispatcher. And step 7. Have important medical information ready.
Those are very clear, actionable steps. And knowing them, especially that fourth one about the door, really can make a difference.
Dear friends, knowledge is power. Understanding and remembering these steps, especially recognizing symptoms early on, and that vital fourth step of unlocking the door, can make an enormous difference in a critical situation. It not only helps the emergency team reach you faster, but also gives you a greater sense of control in a frightening circumstance.
And I think it's important to say, Daniel, that while thinking about these situations can be uncomfortable, this kind of preparation isn't about living in fear.
You're absolutely right. It's about living more confidently, knowing you can take action to protect yourself. We truly encourage you to share this information with your loved ones, especially older adults or those who often spend time alone. Discussing these steps can be a gift of preparedness.
And as always, we'd love to hear your thoughts. Do you have any experiences you'd like to share, or any questions about this topic? Please leave a comment below. Your sharing can help so many others in our community.
Indeed. If you found this video helpful, please take a moment to hit that like button, and if you haven't already, please subscribe to our channel so you don't miss out on important health and lifestyle information. Your support is a great encouragement for us to continue creating valuable content aimed at empowering your senior years.
Thank you all for watching. Please take care of yourselves and those around you.
We wish you continued health and peace. Goodbye for now, and we'll see you in the next video.